The American Heart Association wants to make sure you know about the symptoms and risk factors of a stroke.
FAST, F-A-S-T, is an acronym used to identify stroke symptoms, and there is a virtual simulation people can do to test their ability identifying them. Leah Bowling went to the American Heart Association to find out more.
FAST is an acronym to help you determine the signs of a stroke. For example, F stands for face, and a symptom could be facial drooping.
Facial drooping can be on either side. It can be part of your face or the entire half of your face.
A is for arm weakness.
Weakness of any extremity. Arms are more common, but any of your extremities that's transiently weak or you woke up feeling not normal.
S is for speech difficulty.
Difficulty finding words. Not being able to say the correct words when you're talking to someone.
And T is for time to call 911 if these symptoms are occurring.
Calling 911 is always appropriate if you're worried about having a stroke, because if we get to you quickly, there's way more options for treatment of that stroke.
Dr. Allison Bailey is the chief of cardiology at Centennial Heart at Park Ridge. She says a stroke happens when there's an interruption of blood flow to the brain.
And so it's like a heart attack for the brain. The brain loses that blood supply, and unless we act fast, that won't come back. And so you're left with symptoms of long-term stroke and disability.
Stroke is a form of cardiovascular disease that can affect anyone, but Dr. Bailey says they are largely preventable.
It affects about 1 in 4 adults in the U.S. in our lifetime, which is about 800,000 people a year. And if you have a first stroke, you're more likely to have a second stroke. About 25% of those people will have a second stroke. We know that stroke occurs most commonly in people who have elevated blood pressure, elevated cholesterol, elevated glucose, or who don't have a healthy lifestyle.
Dr. Bailey says it's so important for people to be educated and invites anyone to try out the stroke simulator on stroke.org.
Anyone can log in, and if you go down the page, you'll see the stroke simulator. You can take a picture of yourself, and it kind of changes it to make it look like what you may look like if you were suffering from the symptoms of a stroke.
I'm Leah Bowling, Local 3 News.
If you'd like to learn more, we have other educational tools linked on our website.